There's a new but small outbreak of a highly contagious respiratory disease at an East Bay high school. Officials at Foothill High School in Pleasanton say they've had fewer than 10 cases of whooping cough, and notices have been sent out to families of students who may have been exposed to the disease. For more on whooping cough, I'm joined now by KTVU medical expert Dr. Larry Burchett. Dr. Larry, always great to see you.
Hi, how are you doing?
I'm all right. Well, so let's talk a little bit about the symptoms because they can be a bit misleading. Apparently, it starts out a lot like a cold and can quickly turn into an infection if not caught or if not diagnosed. Talk to us about what families can expect and how to tell the difference.
Yeah, pertussis or whooping cough, like you just said, it can look just like a cold for the first week or two. In fact, doctors in the ER, I don't even think about that when somebody comes in with a cold unless they've been exposed. So the case where this high school where a handful of students got pertussis, then if somebody develops a runny nose and a cough and a fever, then I'm going to be very suspicious and want to treat for pertussis. In the beginning, it's like a cold, but then 2 or 3 weeks into it, it develops this really nasty cough. That there's two things about the cough that I think. One, kids cough so much that they can't catch their breath and they go, and that's the whoop. That's why it's called whooping cough. The other thing is they cough so much that they vomit. But this only happens after 2 or 3 weeks of cold symptoms, so it makes it really difficult to diagnose if you haven't been in an obvious exposure like this high school.
So a prolonged cough is the best indicator to go and see a doctor and decide whether it's whooping cough or something else?
Yeah, I would say number one is, have you come into contact with anybody who has pertussis or whooping cough? That's number one. After that, we don't think about it until people have a cough for 2, 3 weeks that doesn't go away. Like sometimes 10 days, 2 weeks, a cold can last that long. Once you're getting into the 3-week range, that's a bit long. The problem again is that if you get antibiotics at 3 weeks, it's not going to do very much. You have to do it earlier. So that's why we're kind of stuck with this. And for those cases where it's not obvious that there was an exposure, vaccination prevents that.
And we've been showing a lot of video of babies and the shot that they can get. And I know that babies are usually among the most vulnerable. Talk to us a bit about the effect and what the difference is. We're seeing an outbreak in high school students, but children are usually most at risk, correct?
Yeah, right. So in 2010, there were 10 deaths associated with pertussis, and children, elderly and children, because their immune systems aren't as strong, are more at risk. Again, the same conclusion. This is why we give the vaccination to prevent that, starting early in childhood and then kind of with these frequent boosters.
And I know in Alameda County, there have been 98 cases of pertussis this year compared to 77 in 2016. How can people start to protect themselves, especially with an outbreak that we're seeing in Pleasanton now? Should more people be concerned and going to get that vaccination?
I don't think the numbers that we're seeing this year are low. They're not as bad as 2010 or 2014 were higher. So I don't know that I would want people to be alarmed outside of that high school community where people may be exposed there. If you were exposed there, go to a doctor. I'm sure public health is involved with that high school and get the antibiotics to prevent developing pertussis. For the people in the rest of the Bay Area that aren't around there, I don't think this is reason to alarm or to do anything different. Of course, like you're saying, I would always suggest to make sure your vaccination status is up to date on this one. This is kind of a miserable thing. It's the 100 days cough. It's like a cough that lasts for over 3 months. It's really miserable.
Yeah, that's awful. I know yesterday my doctor was asking me, she said, have you gotten that whooping cough vaccination yet? I said, no, I haven't gotten it. She said, you need to get it. And I know they're suggesting and recommending that pregnant women get that vaccination. So.
Absolutely. Your doctor.
All right. Dr. Larry Burchett, always a pleasure to talk to you. Thank you so much for joining us today. Have a wonderful holiday.
Same to you.
Thanks.